Hello, everyone. This talk is going to be about the brainstem and other structures, which I realize is a weird way to lump it all in there together. When we're studying neuroanatomy, I don't find it too terribly difficult to know the lobes of the brain and their function and what would happen if there was damage there. I don't even mind learning about the different nerves and the direction they travel. That's not so bad. But I always felt that when we got to the brainstem and some of the other mini structures like the internal capsule, the cerebellum, the pituitary gland, the basal ganglia. I mean, it just goes on and on with all these other little bitty structures and how they all intertwine. It can sometimes get rather complicated. So I've tried my best today to take some of these parts and pieces and just give you a blunt way to think about them or memorize them or know where they are. And for some of them, the most important thing is going to be if there was damage to this structure, what would it do to one of our testing in the field? So luckily for us, we are not studying to be doctors or surgeons who would have to know these structures in depth. We just need to have a general understanding of them. We're going to start off talking about embryonic development. So, whoa, we're going way back, way back to when the sperm and the egg unite and the very first formation of brain structures. In the beginning, we have three parts: the forebrain, the midbrain, and the hindbrain. Now, the forebrain is also known as prosencephalon. Pros is Greek for the word forward, and then, as you know, encephalon is Greek for brain. The midbrain is also known as the mesencephalon. Mes is Greek for middle. And then the hindbrain, it's also known as the rhombencephalon, which includes the pons, the cerebella, and the medulla oblongata. So I know that's a lot of words to throw at you. But I don't know on a board exam. They may say something like, which of the following was included, in the three main structures of the primary vesicles. Just be able to recognize forebrain, midbrain, hindbrain. And then also, because we don't know how they're going to word it, they might not use those three words. They might say prosencephalon, mesencephalon, and rhombencephalon. So just be able to recognize that those mean the same thing, and then know that forebrain eventually becomes the brain. Know that midbrain eventually becomes the midbrain, well, as its name states, and then hindbrain eventually becomes the pons, the cerebellum, and the medulla. So it all divides, and then it divides again, and then it divides again. So again, we don't have to get real specific and know every little detail, but a general understanding. Also, some books divide them differently. So depending on the kind of textbook that you're studying, it might divide them a little bit differently. All right, here's a picture of the forebrain, the midbrain, and the hindbrain. All right, now as I said, they divide and then they divide again and then they divide again. So I want you to know further divisions that the telencephalon will eventually be the brain. The diencephalon stays the same. Then the mesencephalon is going to become the midbrain, and that makes sense because mes means middle. The metencephalon will become the cerebellum and the pons, and then the myelencephalon becomes the medulla oblongata. Okay, now the actual brainstem. Now we're getting to something that is really important, and we need to, delve deeper into it and truly know the function of each part of it, be able to recognize it, label it, you name it. Where is it located? It's located below the occipital lobe. It appears to be a swelling at the top of the spinal cord. It has white matter, gray matter, and peripheral nerves that enter and leave it. It's divided into the midbrain, the pons, and the medulla oblongata. The brainstem sends and receives motor and sensory messages to the head and neck, just as the spinal cord does for the rest of the body. These messages are relayed by cranial nerves in the brainstem and spinal nerves in the spinal cord. If you divide the brainstem from the front to the back, the front of it is called the cerebellar peduncle, the middle is called the tegmentum, and the back is called tectan. Now, sometimes we refer to the brainstem as the bulb because of its shape. All right, so you should definitely be able to recognize a picture of all parts of the brainstem and be able to label them, know their order. And I know it kind of is weird that the midbrain is actually on top because you think it'd be in the middle, but it really means that it's in the middle of the brain. And in fact, if I show you a picture of real anatomy where the brain is still attached, you can't even see the midbrain. So that's why I'm kind of showing you what I call the cartoon version here, so that you can actually see the midbrain. The pons is the easiest. It's the big fat part in the middle. And then the medulla is continuous with the spinal cord. So the medulla is at the very top of the spinal cord. The cerebellum is usually easy to recognize. It's behind the pons. It's under the occipital lobe, and it has those stripes. So it's called striated. Here's a real brain. So I like to show both the cartoon picture because it's easier to label those, and then I like to show the real one. So in this picture, again, because the brain is still attached, we can't really see the midbrain. It's up in the middle of the brain. We can't see it. We'd have to take the lobes of the brain off to see it. The pons, again, is usually easy to recognize because it's kind of a fat swelling, and then the medulla comes after that, below the pons. Again, if you look at the cerebellum in this picture, you can see how it's striped. So it has a very distinct look, and it's usually easy to pick out. The midbrain. Well, it's also called the mesencephalon. Again, I really need you to know that. It controls ocular movement, pupil size, elementary forms of seeing and hearing. It houses neural centers that are essential for consciousness. It has something called the inferior colloquy, which extends out laterally, and it connects to the medial geniculate bodies. Those are involved with hearing, which I know you know that because I covered it forwards and backwards in the evoked potential talks, because it's really important to evoke potentials. So they are involved with hearing, reflexes that are located in the midbrain. In the base of the midbrain is the substantia nigra, and that plays an important role in motor control. So degeneration of the substantia nigra occurs with Parkinson's. So I said not only do we need to know, the functions of the whole brainstem, be able to recognize them, but know what would happen if there was damage. And so again, Parkinson's is an important one. We're going to go over it again in a little bit. The pons. It's the middle portion of the brainstem. The medulla oblongata, also called the myelencephalon. It's the lowest part of the brainstem, and it's continuous with the top of the spinal cord at a place called the foramen magnum. It controls blood pressure, heart rate, respirations, swallowing, and vomiting. Now, another important thing is that the second order neurons, so remember the first, second, and third order neurons, in the pyramidal tract, they cross here. Another name for cross is decussate. That is really, really important to know. It's an important part of our anatomy, especially in our field. So we all know that if there's damage to, say, one side of the brain, that the symptom is going to affect the opposite side of the body. So it's important to know, where does that crossing occur? Well, here it is, in the medulla. The cerebellum. Again, it's located beneath the occipital lobes. It's behind the brainstem. Its two main functions are coordinating skilled voluntary movements, influences muscle activity, and it controls equilibrium and muscle tone. It has two hemispheres that are separated by something called a vermis. Lesions here would cause incoordination and tendency to fall to the same side of the lesion. So that's the important thing I want you to understand about the cerebellum, is that because of how it's made up, it does have some crossing, but it crosses more than once. And so a lesion on, say, the left side of the cerebellum would affect the left side of the body. So it has ipsilateral issues. So always remember that. Another important thing about the cerebellum is that it doesn't really affect the EEG. Disorders of the cerebellum don't usually affect the EEG. So remember that for a board exam question. The limbic system. Its primary functions are to support behavior concerned with survival. So remember, fight or flight. So emotional reactivity, flight from danger, attack upon threatening objects. That's when your limbic system kicks into play. It also is responsible for reproductive activity. It's involved in memory, regulation of biological rhythms, sexual behavior, emotions of rage and fear and motivation, and part of the limbic system is in the diencephalon. Hippocampus, another really important structure that we have to know about. It's a convoluted structure in the temporal lobe. It forms part of the limbic system. So it's concerned with learning and memory. Damage here would cause a patient to be unable to form new memories related to facts and events, but not learning new skills. Seizures commonly start in the hippocampus, but we can't do surgery to remove tissue there because it would be more miserable to have the inability to make new memories than it would be to just have the seizures. So you know how we can do extensive testing on somebody, find out where in the brain their seizures are located, and then doctors could remove that tissue? Well, we have to find out where that tissue is and what function it has first. Then we have to explain to our patient what function they would be losing if we took that tissue out. Because in this case, yeah, it would be worse than for them to just have the seizures. So always know hippocampus has something to do with your memory. The diencephalon. All right, you should really know that by now because we covered it in related procedures because it's so important when it comes to visual and auditory evoked potentials. Okay, so it consists of masses of gray matter which serve as a relay station for sensory systems except for olfactory. It lies between the midbrain and the cerebral hemispheres. It's involved with coordination and regulation of activity within the entire central nervous system. It divides into the epithalamus, hypothalamus, metathalamus, subthalamus, and the thalamus. The two main regions that we hear about over and over again are the thalamus and the hypothalamus. Not all textbooks go into great detail about the other divisions. So when we say cerebral hemispheres, we are including the diencephalon. The third ventricle is a cavity that separates the diencephalon into two equal halves. So here's a picture. Again, we'd have to take the lobes of the brain off to be able to see the diencephalon. So it's two big swellings at the top of the brainstem. In this picture, just below it, we can actually see the midbrain. Then the pons is in the middle, the part that sticks out a little bit there. And then the medulla, which is continuous with the spinal cord. The thalamus. It's two oval masses of gray matter, one on each side of the third ventricle. It's crucial for sensory perception. Rudimentary forms of sensation are received by the thalamus and relayed to the corresponding cortex. All sensory impulses that are being sent from the body to the brain pass through the thalamus, except for olfactory. It's also known as the pacemaker of the brain. Really, really important that you know that, because it gives form and frequency to our EEG waves. It's a central way station and a relay station between the brain and the spinal cord. Lesions here can cause sensory loss, spontaneous occurring pain, or excessive reaction to a very light touch contralateral to the site of the lesion. Okay, the hypothalamus. It is small and located below the thalamus, hence the name hypo means below, and it affects most, if not all, of the central nervous system by controlling the maintenance of the internal environment of the body, which is known as homeostasis. It works with the pituitary gland, and it's the controlling center of the autonomic nervous system, which includes drinking and eating activities, so like dry mouth and appetite, visceral functions, and that means movement of the intestine, bowel movements, and urination. It also controls blood pressure, salivating, sweating, pupillary dilation, hair growth, temperature control, release of norepinephrine, release of growth hormone, and release of prolactin, which is milk secretion. So it has a lot of duties. It's deeply involved in attentiveness and readiness for us as a whole to be able to react. The hypothalamus contains mammillary bodies that relay sensations of smell. The optic chiasm passes between the hypothalamus and the pituitary gland. Now, what would happen if we had a lesion of the hypothalamus? It could produce disturbances in hormonal functions, hyperreactivity, emotional instability, disturbances of sexuality, changes in feeding that would often lead to weight gain, disturbances in the ability to learn and recall, and irreversible coma. So you definitely need to know this. These are symptoms, so like if you were reading a history and a case study, it might mention one of these, and so you would need to immediately think, aha, there's a problem with the hypothalamus. The epithalamus. It's the most dorsal division of the diencephalon. It's made up of several structures, including the pineal body. The pineal body is felt to be part of the endocrine system, which secretes hormones such as melatonin, which provides the dark pigmentation to our skin and our hair. The epithalamus works as the biological clock that sets our circadian rhythm, and it influences our reproductive system. So when you hear women say, my biological clock is ticking, this is what they're talking about, that they're only able to reproduce until a certain age. The metathalamus. Again, I really hope you know what that is by now, because I covered it so extensively when we were going over evoked potentials. It is another name for the medial and lateral geniculate bodies. Please make sure you know that. They are oval-shaped swellings that both receive and send fibers. The lateral geniculate bodies receive fibers from the optic tracts, and then they project those fibers to the primary visual cortex in your occipital lobe. The medial geniculate bodies receive acoustic fibers from something called the inferior coloci, and it projects them to Heschl's gyri, which is in your temporal lobe. The subthalamus. Sub because it means under. It's made up of several gray masses. Its function is regulating motor activity. Make sure you know that. Subthalamus regulates motor activity. Lesions here could cause violent, forceful, and persistent movements, such as choreiform movements, and something called ballism, which is a Greek word that means to throw, and hemiballism, which is when it's located to just one side. So we're used to seeing a Parkinson's tremor. We're used to seeing the jerking caused in seizures, but a lesion here causes really weird looking movements. So really odd movements of someone's arm and leg. It's more spastic. Sometimes it could look like even a dance-like movement. So it's very odd. It's not like the jerking that we see with a seizure. Medial lemniscus, another really important part of our neural anatomy system. Now, lemniscus is a Greek word which means a woolen ribbon, and it has lots of other names, medial fillet, Rails band, and Rails ribbon. It's a bundle or a band of white nerve fibers in the posterior column, so in your spinal cord. It ascends, which means it goes up from sensory nuclei in the spinal cord, and it goes up to that rhomencephalon, and it ends in the thalamus. Its function is to carry sensory information received from the arms and the legs to the thalamus. So it's important in almost all of our tests to understand what this is. So in other words, whether you're taking your EEG boards, your nerve conduction boards, your evoked potential boards, you really need to understand this one. The medial lemniscus originates in the gracicle and cunate nuclei in the lower medulla. It crosses in the lower medulla and then goes up through the pons. In the midbrain, it passes over the dorsal border of the substantia nigra, and it's displaced laterally by the red nucleus. It passes medial to the medial geniculate body and then enters and terminates in the ventral posterior nucleus of the thalamus. Now, I know that's a lot, and you don't necessarily need to know every single little structure that I just mentioned. Know it's a bundle of fibers. Know that it's in the posterior column. It goes up, and that it sends sensory nuclei to the thalamus. Know that it carries sensory information from the arms and legs to the thalamus, and then it's going to go on to our somatosensory cortex so that it can be interpreted. So it's very important. The pituitary gland, we've all heard of that before we ever even decided to become an EEG technologist. It's a small, very small, hormone-producing gland. It extends from the hypothalamus. It sits in a bony cavity called the sella tertia. That is often a board exam question about what it sits in. It's part of the endocrine system. It's responsible for hormonal production, and it's controlled by the hypothalamus. The basal ganglia. Again, not something that we normally would have heard of if we weren't in this field, but it's very important, and especially in a few of our neurological disorders. So it's gray matter, and it's located deep within each hemisphere. It's concerned with control of movement, particularly the initiation of voluntary movement. It controls our balance, posture, and muscle tone. The basal ganglia and the cerebellum form the extrapyramidal system. The main components, and I know these are some weird words and we don't need to really dissect them, but you do need to recognize these words. There could be a board exam question, multiple choice, which of the following are part of the basal ganglia? Or it might say which of the following are not a part of the basal ganglia. So make sure you understand, even if you can't spell them or pronounce them, make sure you know that caudate nucleus, putamen, globus pallidus, and amygdaloid nucleus. Make sure you recognize that those are all parts of the basal ganglia. Disorders of the basal ganglia include Parkinson's and Huntington's chorea. So both of those have symptoms that involve odd movements, the tremors in Parkinson's and the dance-like movements in Huntington's. You can't really see pictures of the basal ganglia and the limbic system. They're like throughout the neural anatomy. It's not like you can really point to one little thing and go, here it is. So you don't have to recognize a picture of it per se. You don't have to label a picture of it. Here's just another view. Again, you don't have to label it, but some people knowing exactly where in the brain it's coming from is helpful to them. All right, so Parkinson's, you learned about this during neural disorders. It's a slowly progressing disorder, consists of a tremor, mask-like face, stiffness, balance problems, shuffling of the feet. It actually has a lot of different symptoms, and the symptoms will change. So they may have, several symptoms for a while, and then a couple of them will go away and they'll get a different one. So they're constantly going back to the neurologist to have their medicines adjust. We cannot cure it. All we can do is treat the symptoms. It is a disorder of the basal ganglia, and it affects that substantia nigra due to lack of dopamine. So know that about Parkinson's. That's a very common board exam question. Huntington's chorea, a rare genetic disorder, severe atrophy of the cortex, especially the frontal lobe. It causes quick jerky movements. It also causes some dance-like movements. It can make the EEG low amplitude, no known treatment, and death can occur within 15 years after the onset of symptoms. Very sad. Okay, so I hope that wasn't too terribly painful. You might have to listen to this video a couple of times, but instead of memorizing like a huge paragraph about each of these things, just know some bullet points about them. Make up some flashcards with the part on one side, like the epithalamus on one side of your card, and then on the other side of the index card, what the functions of it are, and then know how to go through those cards forwards and backwards. That's what's going to help you.